So we can whisper.
So we could, yes.
Well, good morning. Let me welcome each and every one of you here to our workshop this morning. My name is Bill Purcell, and I chair the Roundtable on Obesity Solutions. And I want to welcome not only those who are here in this room, but also those who are joining us on the web. As of this morning, that is approaching 600 in number, and we are very pleased that they're able to join us in that way. The Roundtable on Obesity Solutions was established by the Health and Medicine Division, formerly known as the Institute of Medicine, a little more than 3 years ago now, to engage leaders from multiple sectors needed, we believe then and more strongly now, to solve our nation's obesity crisis. Within the Roundtable, we include representatives from healthcare and academia, business, health insurance, education, child care, government, media, philanthropy, diverse nonprofits, and the rare, thankfully, and outlying lawyers, such as myself. Through discussions, public workshops like this one, publications, and our 4 innovation collaboratives, the Roundtable provides a venue, not just when we're together here, but we hope throughout the year in many places, a venue for inspiring and developing multi-sectoral collaborations and policy initiatives. The end of this work, we hope, is to prevent and treat obesity and its adverse consequences along the entire lifespan, and to eliminate obesity-related health disparities, a particular and continuing concern of this Roundtable. Our workshops, discussions, and related products and publications have focused over the course of these 3 years on the current state of obesity solutions and how to drive progress. We try to highlight promising multi-sector environmental and policy approaches and how to overcome challenges, not only in implementation, but also in scalability. We have, during this time together, and the Roundtable members themselves have lived through this experience, but it's worth remembering that we've explored a wide range now of the sectors and topics with this basic goal in mind, including the role of physical activity, obesity solutions in early childhood, the role of business in these efforts, the changing media landscape, what the public's perception, knowledge, and understanding of the obesity epidemic and its causes and correlates may be, the role of technology in obesity solutions, better understanding of issues related to management of severe obesity, lessons from international cross-sector efforts, and the impact and opportunities of public policies at the local, state, tribal, and federal levels. The results of these workshops, these perspectives and others, many of them are available to you here. Those of you who are in the room as a part of the materials just outside the door, but all of them are available online and will continue to be forever. Finally, we would continually remind you of our desire to explore and weave through all of our activities cross-cutting issues related to weight bias, stigma, adverse childhood experiences, and other issues that are related to eliminating health disparities in obesity prevention, treatment, and weight medicine. What we've learned through the work we've done so far, and in the context, frankly, in which it is the context in which we start today's workshop, may be a very simple thing to say, and for some obvious and long understood. But I think it's an important point to begin our work again by acknowledging it's a complex issue, that the causes are clearly multifaceted, and we believe strongly based on the evidence, so are the solutions. Solutions to obesity require consideration of the individual, including genetics, demographic factors, psychological and social factors, as well as the policy and environmental factors that support individuals in their homes, their communities, their work sites, their schools, and childcare, as well as in healthcare. And this through an engagement of a multitude of sectors and leaders who can mobilize the needed changes. Additionally, we recognize as a Roundtable obesity as a chronic disease. It is a disease like other chronic diseases that can be addressed through science-based prevention and treatment approaches. Prevention and treatment, both essential to discussing the solutions to obesity. Today, we focus on what we know about treatment. of both obesity and overweightness in children and adults, and the challenges involved in implementing them. The focus on treatment should be placed in the context of the comprehensive approach to solutions to obesity. So, as a roundtable, our goals for the day include reviewing what works and identifying emerging treatment opportunities, reviewing what we know and identifying opportunities to improve the treatment of severe obesity, exploring policy, payment, workforce, and training considerations, discussing promising approaches to overcoming the challenges in the treatment of obesity. Our planning group would ask me now to make two key points here at the beginning. During the course of this workshop, treatment is defined broadly to include all surgical, pharmacotherapy, and behavioral therapies, and it's important to acknowledge the definition of successful or effective intervention differs depending on the context of the discussion. And then as a final point of this preamble, and that's, after all, what this is the preamble to a day of hard work and we hope discovery together, and that's the role of the chair to allow you to digest your breakfast, settle into your room, remember why you came, remember your purpose in life, and then remember that you really would rather be here because it's not very nice outside. So this is exactly where you want to be, in a dark, wood-paneled room deep inside this National Academies of Sciences. But I want to, as a part of that preamble, and I think it benefits you to have a moment, all of us, to look at a set of slides selected by Bill Dietz, slides well known to the Roundtable and I think to everyone who is a part of this discussion, but they are, after all, the basic data set that defines where we are at this point. And this shows us from NHANES data from 1999 to 2014, and again, been presented many times in many different settings and is a part of our basic understanding of where we are. But the prevalence in America now stands at 37.9%, women at 40%, men at 36%. We'll see in a moment the prevalence among children at 17%. We acknowledge and some celebrate the fact that there is a plateauing, apparently, among men at this point, but when we also see from the data that there is a significant continuing increase in women, the plateau that will be reflected in a moment in children and youth is also something to appreciate, but we remember as well that in 1960 the number was 13% and 15% in 1976 to 1980. Therefore, it has more than doubled since 1980. When we take a look now by ethnicity, we see straight away the disparities that continue to face us, most especially among women. There is not, at the moment, a statistically significant difference among men, but there is clearly an extraordinary difference and disparity, especially involving non-Hispanic black women, with a number now at 57%. When we look at children, we also find these disparities. They are there's a different pattern than adults here, but the reality is quite real at a young age, and we see again, I think it's clear from this chart that the disparities begin to appear at an early age, and they continue now to plague us even despite 2 generations of work on the issue. And now we look at severe obesity, and it's increasing in both men and women. And those numbers, again, are from the period 1999 through the year 2012. When we look, again, at the issue of disparities, we have special concerns as well, especially in the category of non-Hispanic black women, but we see these disparities as real, and this issue continuing to dominate our thinking here within the Roundtable. When we focus on children, over time now severe obesity is increasing. Some movement, as you see, some switching and trading of places between 8 and 9%, but overall the trend lines remain a constant in an upward movement in this area. When we look now at severe obesity, again, on the issue of disparities and ethnicity, we see the same kinds of patterns that we saw previously in obesity overall, extraordinary numbers, extraordinarily high numbers. And then our last meeting in January, we focused on the cost. And the cost is, there's plenty of science in the cost, and there is some art. There is no question at this point. But when we think about the cost to our society as a whole, whether you take the high number or the low number, you're looking at an extraordinary number in terms of cost. Chad Meyerhofer of Lehigh University gave us the number of $872 billion. Work also done last year by the Milken Institute, Weighing Down America, the Health of Economic Impact of Obesity, has that number at $1.42 trillion overall. And this is all in, everything, but again, the cost to us all, whether it's cost to us individually or as a family or as a nation, remains huge. And when we look at the world as a whole, where the numbers are less certain for us, and this particular chart is from the World Health Organization from 2014. This is specifically as to women, and the numbers estimates are slightly different for men, but at the core of it all, 13% of the entire world's population is believed to be obese. As we gather here today, 600 million individuals, 15% of women, 11% of men. Remember that the number in the United States is 37.9%, much higher. But at the core of our findings and beliefs, not just here in the Roundtable, but as a nation and here as a world, worldwide prevalence of obesity has more than doubled between 1980 and 2014, just as it has in the United States. It's an epidemic. It confronts us all. It continues to confront us, and so there is no better time for us to convene and think again about what we need to do individually and as a nation to end that epidemic. For that purpose, then, it's my special pleasure to thank the planning group, including Natalie DeGatti, Muth, Dr. Anelli, Bill Dietz, Scott Kahan, Adam Sy, Ted Kyle, Tracy Zvenovich, and Carolyn Apovian. And I want to give special thanks to the chair of our planning group, Don Bradley, as well as Amanda Newen, who from our staff led the planning group to this point. The biosketches of all the committee members are in your materials, as are the sketches of all of our speakers. They are incredibly long, each and every one of them. So you will find that Don Bradley will not take you through all of them. This is not for anyone who is presenting and new to this group. We have not in any way overlooked each and every one of your accomplishments, and your much longer and critically important biographies will be available to the general public as well as your families online, again, for forever. It is therefore, in that context, a special privilege for me to present Don Bradley. He's an associate consulting professor in the Department of Community and Family Medicine at Duke, and the director for the Practical Playbook. He retired, which is a hard thing to say about him, from Blue Cross and Blue Shield. He doesn't appear retired in any way. He served in a slew of roles at Blue Cross and Blue Shield of North Carolina. He was the executive director of their federally qualified health maintenance organization, senior vice president of healthcare, chief medical officer for over 20 years. He is, for our purposes, an essential and critical and outstanding member of our roundtable. And for your purposes, most importantly, he was the chair of the planning group. Don Bradley.